16 years. That's how long it's been since flu cases were as high as they are now all across the country. And the impact is also hitting home. So emergency rooms and hospitals are also feeling the spike in flu cases. Queen City News anchor Robin Kennedy live at Novant Health in Charlotte's Elizabeth neighborhood. So Robin, what did a doctor tell you that they're seeing right now in the hospital there?
Yeah, Alicia, the Novant Health doctor says the high number of flu cases is likely going to impact everyone's wait time in the emergency room if they have to come here. And we also found that COVID could be making a comeback.
Like many other hospitals, flu cases are surging at Novant Health in Charlotte.
I was even working in the hospital over this past weekend, and I had a doctor tell me it seems like everybody is admitted for the flu right now.
Dr. Kramer McCullen, a family medicine doctor at Novant, says over the weekend, 1 out of every 3 of his patients in the hospital had flu or complications from the virus.
I think, definitely overwhelms the emergency department with cases.
Dr. McCullen says the severity of the flu is also worse this year. And even patients who are otherwise healthy are having complications like pneumonia from the flu. That's putting more people in the hospital than in years past. And it's having an impact on people who visit the ER for other issues as well.
So really high percentage that are probably leading to longer wait times in the emergency department, longer holdovers of patients in the hospital during this season who are requiring treatment.
Alicia Allman is a physician's assistant at StarMed.
We have seen more flu than anything else.
She's barely seen any COVID cases recently.
So they may be assuming it's a cold and just treating it with over-the-counter medications and not seeking any testing at all.
We did find data from the state that shows the amount of COVID in the wastewater increased in most all of the Charlotte monitoring locations and more than doubled in West Charlotte in recent weeks.
What we see in the wastewater may be lagging behind, so did we hit our peak? Maybe. But COVID is harder to predict a peak since it doesn't seem to be quite as seasonal as flu.
Now, what's driving the severity of these flu cases in particular? Both health professionals we spoke with say it could be vaccine fatigue, the fact that maybe fewer people got their flu shots this year, perhaps focusing on COVID vaccines or just not getting either vaccine. I'm live in Charlotte. Robin Kennedy, Queen City News.